So I grew up in a family with a bunch of boys. I was the youngest of four. I had three older brothers, and there was definitely not a tampon in sight. There was no discussion about cycles and definitely no understanding about what would be healthy or not healthy in regards to my menstrual cycle. I am appalled at how many women and men actually have no understanding of what is happening in the cycle for a woman in that 28 days. And in fact, a lot is occurring. So I'm going to discuss what would be normal and what would be abnormal, considered healthy or unhealthy, in the very basic, simplistic form of the cycle. So every woman should know this, and every woman who has a child should maybe share this with their daughter. If you have a partner, you might want to hear this because you'll understand your partner. And if you're a provider and you want to share this with your patient and not reiterate it every single time you see a patient, this is the podcast for you, and please share it. I'm Dr. Lund, and this is But I Don't Like Needles. One of my favorite aspects of being in this practice after so many years is working with preteens and teens because they have no awareness as to what's happening with their cycle and what is considered healthy and not healthy. Even when you start to talk to someone about their cycle and they've never discussed it, they start to feel shy. You see their bodies sort of withdraw, and there's some sort of shame around talking about this subject, which makes me very sad and frustrated. So I want to get this information out. Let us start with these young adults who are in their health class. They are like in 6th grade and they learn about the nuts and bolts of what's happening inside in regards to their cycle, maybe a little bit about STDs, maybe a little bit about being safe. They don't go through what's really important too, which is the day-to-day. What is happening in their bodies in regards to their cycle? What is going on? Should they be feeling pain? Should they be having headaches? Should they be having, what type of bleeding should they have? Why are they having acne? And the truth is, none of that is normal. None of it is healthy. We think it is. We chalk everything up to hormones as if that's normal, but it's not. We just move the needle so that we accept what's abnormal to be normal. And this is an ongoing conversation I think you'll probably hear as a theme in a lot of my podcast is that concept. And I will repeat this. We are not to have headaches. We are not to have pain with your cycle, before your cycle, during your cycle, after your cycle. We are not supposed to have bloating. We are not supposed to have these mood swings. When things are in a healthy balance, you don't have that. Same thing is for pregnancy and for postpartum and all those sort of major transitions in our life, menopause as well. What's happening is we're getting in our own way. The things that we are doing in our diet, in our lifestyle, is disrupting our natural flow. And I'm going to help you with that because how do we even know what our normal flow is? And then how do we know what's going to disrupt it, right? So let's start from the beginning. And I'm going to look at this from an East Asian medicine perspective as well as a biomedical perspective. So first of all, how long is this cycle supposed to be? The normal cycle, I think most people will understand this and hear this often, is that it should be a 28-day cycle. This is an ebb and a flow. 28 to 32 is more of a comfortable, common ebb and flow. Everything is balanced. Everything is yin and yang. Nothing is going to be finite. So we do have a breath on this in regards to a little bit later. When you look at the biomedical side of things, it is biphasic. Biphasic means there's two sides to this, and there's two beginning before ovulation and post-ovulation. The pre-ovulation is called the follicular phase, follicles, follicular. This is where the follicles are developing, and this is where it goes into ovulation. And then you have post-ovulation, which is your luteal phase. And that is where if you are having a fertilized egg, then you will continue with pregnancy and that will develop, or your body will recognize that there is not a viable pregnancy and then it will discard and you will have a menstrual flow, which is your lining that is going to be relieved from a hormonal shift. So we do understand that basic usually because that's what we've been taught, biomedically speaking. But when you actually look at it through the lens of East Asian medicine, as it usually is, It has a little more nuance to this. And we have more of a 4 or 5, even if you want to consider ovulation a 5 phase. Section 2, our menstrual cycle from day 1 to day 28. So day 1 is the beginning of our first phase, and that's when our bleeding begins. That's what we consider our menstrual cycle. In Chinese medicine or East Asian medicine, this would be considered your blood cycle. This is when we bleed. For those who are having a menstrual cycle, please understand it should not be painful. It should not be any pain leading into it. There shouldn't be any pain during it, and there shouldn't be any pain after it. If there is something that is out of alignment, and you want to see your acupuncturist because we help with that. Also, your blood when you're bleeding, it should be bright red. It should be a nice, healthy red. It should not be dark. It should not be clotted. So there's different size clots. There's tiny little clots, small clots, and then everything from very large clots. But overall, this is a sign of stagnation, of blood flow not really occurring as smoothly as it could. Again, see your acupuncturist because this can be helped with that. The other thing is the amount. So are we having just 2 or 3 days and it's very light, or are we having 5 to 10 days where it's extremely heavy? So this is important for us to recognize that going above 5 days with a heavy flow or more than a medium to heavy flow is excess, right? It will lead to anemia and deficiency. So we call this kind of a Qi deficiency, or it could be blood heat. There's a lot of patterns for us. That, again, can be treated with acupuncture and herbs. There shouldn't be any discharge. There should not be any spotting before. It should just sort of come, and then it should stop. If it's spotting before, we have a hormonal imbalance. If it's spotting for a long time after, then we are having a hormonal imbalance. So those are things to be understood about our blood cycle. Yin cycle is the next one. The blood cycle's from like days 1 to 7-ish. We want to make sure that we keep our menstrual cycle bleeding and done by day 7. Once we get into the next phase, 7 to 14-ish, now it's what we consider the yin cycle. And the yin cycle oftentimes loosely relates to estrogen or estradiol. This is when our estrogen starts to increase. You'll see that if you are looking at your blood work. This is because it's fueling our follicles. Our follicles are building, they are growing, and they are getting ready for ovulation. That is going to continue up until day 14. During that time, we will have a shift where we will have a change in cervical mucus. This means that the vagina will change. Instead of a thicker, more white, dense discharge, it will switch to a liquidy, clear, watery, slippery discharge. And that is a shift that happens in the vagina right before ovulation. It's about 3 days ideally, sometimes more, sometimes less. It is a sign of fertility. It is a shift from an acidic environment, which is what the vagina normally is, to more of a base pH balance, which is where it literally opens the door and brings in the floodgates specifically for a sperm so that it can live in that environment, survive in that environment in order to fertilize the egg. A sperm can live up to 3 days, thereabouts, give or take. And that normally that window is before ovulation. So those of you that are looking to not be pregnant, obviously this is not the time to be unprotected sex, because this is the window of time when that's supposed to happen. And it can also happen a day or so after, but I will say that the most prominent is before. But again, it's also a day after the ovulation occurs. You'll know when ovulation occurs. Oftentimes, some people will feel a little cramping in their ovaries, one side or the other. But what will definitely show you that is an ovulation test. And that is the test of something called luteinizing hormone. Luteinizing hormone does go up, it skyrockets, and estrogen will drop, and that's when you will have that trigger of ovulation. Estrogen has to drop here in order for that LH surge to occur and for ovulation to occur. This is also where we have run into trouble or problem or delays, or even anovulation, no ovulation, related to the amount of estrogen in our body. I will go into another conversation in regards to estrogen dominance, which is a large portion of our society here in the United States, is that we have a large estrogen dominant community, and that does directly relate and correlate to the things we are putting in our bodies, on our bodies, and relates to toxic chemicals, hormone deregulating chemicals that are in preservatives and in our foods, and a growth hormone in our foods. So we will have a whole nother conversation about that, but they'll relate to certain diagnoses like PCOS, polycystic ovarian syndrome. That is one of many things. But again, many other diagnoses which relate to the infertility and our irregularities of our hormones and discomfort around all of our transitions in regards to menarche and adolescence and menopause and fertility, and all of those things relate largely on this topic, which I'll talk about in another episode. So then you will have that LH surge, your estrogen will ideally drop, and then you will ovulate. When you ovulate, you go into the next phase, which is our third phase, if you don't want to consider ovulation a phase. And then you'll go into the yang phase, which is post-ovulation. So remember, during the yin ovulation time and leading into the ovulation time, it's mostly yin. There are foods that are going to help you with this. There are herbs that are going to help you with this. Same thing with the blood time as well. Acupuncture herbs are going to help you specifically for the different phases of your cycle. If you have issues with the blood phase, you will specifically focuses on that with herbs and diet and lifestyle and acupuncture. And the same thing with your yin phase. Again, very different herbs and different acupuncture and different lifestyle and different diet. Very unique and different, as well as your exercise and workouts, which we will go through in another episode. And then your next phase is your yang phase, and that is your post-ovulation. This is where we would switch into our luteal phase when you think of biomedical medicine, and that is the yang phase because progesterone starts to really creep up at this time. Oftentimes, you're going to be tested for progesterone around day 20, 21 to see if your progesterone is increasing. Your progesterone is very young. Progesterone will rise after you ovulate, and then your lining will thicken. It causes this thickening in the lining, and it keeps you from bleeding. So it's important for you to know that progesterone, if there is deficiency, will cause shorter cycles on your luteal phase. During that time, we really want to pay attention to, again, foods that are going to be warming, herbs that are going to support yang and progesterone, which there are, and then, of course, the acupuncture as well. And it's very important during this time as well to understand that progesterone, before it becomes progesterone, has a precursor hormone called pregnenolone, which does correlate with the adrenals. And if you are in a very stressed state, fight or flight, that is going to adjust that pregnenolone to cortisol instead of progesterone, which is what happens when we have a drop in progesterone and now we bleed early. So stress is related to progesterone, pregnenolone, cortisol around this time. Acupuncture is one of the greatest things that I know to quickly get us out of fight or flight and to regulate the hypothalamic pituitary ovarian axis, which is another conversation as well. Then final 7 days, which is usually day 21 to 28. If you are indeed pregnant, if indeed we were relaxed after ovulation and the smooth muscles of our fallopian tubes were relaxed and the egg was fertilized and the egg was healthy and the sperm was healthy and it traveled and it implanted into a very healthy uterus that is full of good blood and the progesterone was high, the progesterone will continue to go up and you will now have a viable pregnancy. If for some reason it does not get fertilized, then what happens is eventually the progesterone will drop and we will bleed and we'll schlep off the lining, and that starts us back at the very beginning at day 1. So just with that knowledge, there is a huge transition coming between that day 27, 28 phase, between that chi phase. We call it the chi phase because this yang keeps building through that whole luteal phase, and we have to keep the blood moving and the chi moving. And if we are emotionally stagnant, if we are stressed out, if we have anything that's going to hinder or hiccup and get in our way at this smooth transition, we run into discomfort. We run into like a floodgate with a Hoover Dam, and if it's overloaded with these hormones and there is no regularity with the hormones, or there is an imbalance in our hormones at this time, or our stress is over the top and we are not regulating this, it can affect our progesterone and pregnenolone and go into cortisol. But other things that it does, if it's not that severe, is that it will just sort of pause us in this timeline and we can delay these transitions. We delay that smooth transition from the chi phase to the blood phase. And so, again, there's specific movement and exercise that's going to help with this. Acupuncture is extremely helpful for this. And then it will help smooth over the transition from the chi phase to the blood phase, and we will have our menstrual cycle without any pain. So that is the very basics of the cycle for a woman and their menstrual cycle, and relating to their progesterone, estrogen, luteal phase, follicular phase, and then in relationship to Eastern medicine, the blood phase, the yin phase, ovulation, yang phase, and then the chi phase again. So recognizing where the hiccup is, where we have the misalignment and imbalance, is the first step for us acupuncturists. Second thing we do is then, with that diagnosis, alter our treatment plan, give herbs and dietary recommendations and supplements that will assist us in that. If that works out, then we have a nice smooth cycle and no discomfort or irritability or emotional ups and downs, and our body works at best. So that's the basics of it. If you know anyone that might benefit from this knowledge, any woman that you know that might not know this, that could help them, definitely pass it along. If you have a daughter, please pass it along. If you are a partner who is interested, pass that along. And then if you are a doctor and you want to break this down in a simple way, if you feel that this was helpful, please share it with your patients. And until next time, get to your nearest acupuncturist. This is Dr. Lone with But I Don't Like Needle.
The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with a qualified healthcare professional before making any changes to your health, medical treatment, or medication. The views expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of any medical institution.